Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Jon Zimmerman. He's CEO at Holon Solutions. Welcome, John.
John, it's so good to see you again. Thank you for the opportunity to meet with you today and discuss important issues.
Yeah, well, I think this is a really important issue that is the theme for our discussion today: burnout, and I think we're all feeling it. Not just healthcare providers, everyone in the world, and for different reasons. But anyway, before we dive in there, tell us a little bit about yourself and Holon Solutions.
Well, I'm an industry veteran, I guess is a good way to say it. I've been in a lot of the big healthcare IT companies over the years and in medical device companies. And I've always really tried to figure out how to make life easier and better for providers, because at the end of the day, they serve us all and we have to serve them. So Holon Solutions, we actually did a very deep, thoughtful market study a few years ago and say, what's the most important thing to fix when you're going to do new modern technology? What matters the most? And the answer we came up with before it got all the buzz was healthcare burnout. It's sort of interesting that we made that call, and here it is. It's terrible, it's sad, and it needs to be addressed. So we're happy, so happy to have this conversation with you, to share with you what we see, what we do, what customers are telling us, because this must be fixed. This is
Yeah,
not optional to fix. It must be fixed.
yeah. It's crazy to see how burnt out healthcare is, right? I just got a text right before this. Someone's like, "I need to get out of my job. It's killing me," and it's just seeing the burnout is just real. Do you see it getting worse or better? What's kind of your view on how is it trending?
Yeah, sadly, I see it getting worse. Happily, I know and am starting to see it get better.
Mm,
And as we have discussed, it's not one individual or one organization's responsibility. We all kind of got here together, so we all have to get out of this together. So it's going to get worse unless something changes. Okay.
mm.
And I think that's the quote from Einstein, right? The definition of insanity is doing the same thing and expecting different results. So let's take a step back, understand what the causes are, and take appropriate actions. We have evidence that that can be done.
Yeah. I mean, it's interesting to think about, is burnout, like we know burnouts. I think I agree with you. Burnout's going to get worse, but is it going to get, in the aggregate better, or is it going to get worse for many, but could be better if people choose it, right? You know what I mean? Like, it's like, is it a choice that organizations make to improve the burnout, or is it just a system-wide thing that everyone's going to suffer similarly, right?
Yeah, to your point, there are definite causes,
Mhm.
right? And I think they can be identified. Now, there is no quote magic burnout formula or magic wand that you can wave and reduce burnout. It doesn't work that way. It actually takes, like, individuals, organizations have characteristics that make burnout better or worse.
Mhm.
And I think it's important to work backwards, if you will, or work from that from the individuals, understand what's causing their pain and address it the best that you can within the environment that you can. So I think this is not going to, we didn't get here overnight, okay? And we're not going to get out of it overnight, but it's a super important thing for us to figure out. And I'm happy to share more observations and experiences.
Yeah. So what do you see as those kind of core causes for burnout?
Okay. So some of the core causes that we see and can focus on, right, are um, the variety of work the variety and volume of work that's hitting. Okay.
Hmm.
Now, when you sort of parse the work apart a little bit more, much of the work and the desired work is for patient care. That's what everybody trained for. That's what they love to do. That's what they really gives them the benefits and the gratification for what they do. Then there's the rest of it. Okay. And I think the rest of it is based in two major factors. One, unnecessary work, things that they have to do that something can do it for them or someone can do it for them. So that's a group. And then the second group that is also caused by some of that is rework. Hey, you should have done this and you didn't do that. Okay. Why not? So now you got to stop what you're doing and go dig in. So what we try to do is have that empathetic modern technology approach to understand the workers in their work. And then as we engage with them, understand what information do you have to chase or do you miss that should be delivered to you the way you want to see it. I mean, and I can go on if you like, because there's another cause, right?
There is.
The other root cause is the fact that they have similar work to do based on various types of payment models and payer contracts, but it's similar but different. And you need that context for each of those things to be brought to you during the encounter so you can do the right thing the first time easily. This is doable when you understand the root cause of the it's not the information overload perspective, it's the information fragmentation that causes all this unnecessary administrative work and rework that machines can do and people shouldn't have to.
Wow. That's interesting. I mean, as you describe it, like just so many instances of rework and work that does, that they don't want to do come up to mind. Ironically, I did an EHR implementation one time and we had them do the double work, the rework, because they were nervous about going live. And then we leveraged that to go fully live because they're like, why are we doing double work? And we're like, yeah, that's right. So it's interesting how it can be leveraged to implement it as well.
That's a great example because then they got to a better place and then the world changed. I heard a fellow talk about this in an insightful way the other day. He said, we're in the two canoe problem. Okay, we have a foot in the value-based care canoe and we have a foot in the fee-for-service canoe. And it's not a good idea to have 2 feet in 2 canoes. It's going to have a bad outcome.
Yeah, I mean, I remember Farzad saying, how do we flip this light switch on this one and turn this one on? Like you're right, because they're both feet are in both canoes. And that goes to the other question I have is like, are the current laws and regulations and reimbursement structures, if you will, is that what's causing burnout or, and are they producing the right incentives to kind of improve this problem?
I'm going to give you a partial answer and then sort of complete it. From my perspective, going back to the 90s, I think, when you look at it, the laws and the regulations are pretty good and well intended, and the payment models the same. Okay, they're good and they're well intended. I think that's a fundamental thing that we can take to the bank. The problem is really is the fragmentation of interpretation of what they mean based on the various businesses and the combination of different payers that they're similar but different. And if they're different, then you have to know that they're different and do exactly that way, or you will get slammed with rework. So I think that's good. Now, your point about payments, I saw a really interesting example recently at the Class Payer Provider Summit. Okay, and this was another interesting, maybe piece of the formula. It won't solve burnout per se, but one payer was giving payments to the administrative staff for completing tasks. That was innovative, unheard of. It didn't necessarily, reduce work, but maybe it did down the road, and it got them to do the right things in the right sequence with the right incentives. I thought that was innovative, that was novel, and the payer and the provider jointly presented on how effective it was. Okay, so their measures are going up, their quality scores are going up. So that's, I would argue, another tool in the toolbox. Now, nobody regulated the payer to do that, but they innovated and they did something, and it would look pretty effective. Now, I'm not advocating that all payers have to go pay the administrators. I am not advocating for that. I just want to say, but I do want to say that the regulations and the legislation, it's good. I'm not even going to say it's not bad. I think it's good and well intended. It's up to us industry folks to really understand. All right, so how do we take that and make it easy for the providers, because all the legislation and regulation is intended to make the right thing to do, the compensated thing to do.
Yeah, that's interesting. And what an interesting example. I've actually heard the opposite, where a provider paid for one of their staff to work at the payer and to get the answers to the payer questions that they needed. So, which I thought was innovative the other direction, right? Where the provider is like, I need my provider staff there so that they can be internal and get the answers to the questions we need to expedite our payment, which fascinating. But maybe the key is the collaboration.
The key is the collaboration. You said it spot on. And I love the fact that now the borders are being crossed, if you will. Yeah. Because the regulations and the legislation have essentially forced an environment of aligned incentives where they were less aligned in the past. However, they didn't align perfectly, and the systems are so fragmented that collaboration is key. But taking an empathetic approach from the providers who we as people with families all rely on, we should make their lives as easy as possible through the innovative things that are now happening in the world. If it's payment policy, if it's worker placement, if it's information technology streamlining, all of those factors apply, all of them. Okay. Yeah. So that's a great example. That's fascinating. Maybe unnecessary. If the systems would align, you wouldn't have to do that. But that's where we have focused, is aligning the flow of information to follow the flow of good quality intent.
Yeah. So tell me, what are some steps that can be done by, I think there's a lot of groups, which is maybe the other challenge in the fragmentation you're talking about, but what could providers, payers, ACOs do to improve burnout?
I think the very first thing to do is understand your burnout. They may not always be the same. So don't assume that there's some panacea out there that'll go cure burnout. So understand your own, okay? Look at those root causes and then build action plans, right? But I know this after all these years, that the information flow, we should stop having to have providers go outside of their workflow. That's probably the largest thing that can be done quickly. So understand your causes. Some of them may be contractual goals, some of them may be you're not scheduling properly. There's a lot of those, but I know that in every single case, it is important to understand the flow of information to and from the people on the front lines to make their jobs easy. Health is an information-heavy industry. So let's make it lighter on the people who we count on to help us and our families.
Yeah. There's nothing worse than having to dig for the info when you know it's there and you can't find it. That's painful.
And then you don't find it. You go on and you do the thing you were supposed to do, and guess what happens? That's the cause of rework, because then you gotta go do it later when you can't even have the access to the people to do it.
Or it's denied, then you don't get paid for it, and that's that's plenty of burnout too.
Which then creates more rework, right? So we've got to do a much more thoughtful job to do that. I guess I'd add one more point to your question is, when people understand the root causes of their burnout and their pain, share it with the institution or the others who you think might be the root cause. The reason is they have the same pain on the other side. So your point earlier about that collaboration, the idea of the provider putting the staff and the payer, brilliant. The payers trying to facilitate more staff incentives, brilliant. go to the other parties and have an open dialogue with them. We're all suffering from it. We have to fix it together.
Yeah, great point. So talk to me about how Holon Solutions is positioned to help with this problem.
We try to do, well, first of all, what we do is we understand the user's workflow. That's part of what our patented technology does. It's using, AI and ML that everybody's talking about, but what we deploy it to do is to understand their workflow. And we understand the information by asking them, what do you need from whom? Then we go and put the back end of our system, if you will, in place to go get that information, because the sponsors, the payers, want them to see this information. They need them to see it. It's just not in their field of vision, and it's not configured the way they want to see it. So as we get the information, then we personalize it for that user's experience. Think of this as being their iPhone on their system that understands what they do, knows what to go get, gets it for them, and brings it back to them the way they want to see it. So we take a very empathetic approach to relieve their stress of having to look for stuff. This is the third decade of the 21st century. We shouldn't make people do that, okay? So that's how we do it. And then we track everything. Reason, we want to provide that value back to the originally sponsoring organization to say, we're making a difference. And we want to bring that value back to the providers themselves. The cool thing is they're telling us from a physician's perspective that they're saving now, in one instance, 3 minutes per patient per day. Now, if you do 20 or 30 or 40 patients a day, that's real time. And their staff is saying it's 5 minutes per patient, so they're getting even more. So we're starting to actually see that these green shoots of making their lives better is happening. And time is the most important resource in burnout. If you can give them back time to do the things they want to do, taking care of patients, they win. So that's sort of how we do it and what we're starting to see.
Interesting. Is that totally embedded in the EHR, or what's been your approach there? Is it in the EHR so that's part of the workflow? Is it separate? How do you approach that?
We do it in a number of different ways. If we want to use, if the customer wants us to use the API structures in the EMRs, we use them. If the customers want us to work at a sort of deeper level, like the operating system, we do that as well. So it appears as though there's a helpful window that complements and augments their EHR experience, because we have that much more user personalization capabilities, so we can tune it to exactly what they want. So we can go either way, and we do go both ways, but we always try to understand, again, from the providers and the care team's perspective, what's their best way to deal with all the complexity on their payer side and bring them something that fits. So we're open to both sides, APIs or I don't know what that, or AI and ML user experience recognition is our other modality of being able to deliver this value.
Interesting. And where's all the data coming from? Are you using exchanges, or, where, because you're overlaying the data, is it from the EHR and bubbling it up? Talked about the data sources.
The data sources are typically from the risk-bearing entities. Okay, so it's either a population health management system, a care management system. We do use HIE data for certain transaction types, especially for transitions of care type workflows. So what we are non-specific and generally available to any and all data sources. If they have an API set, which some do, we built together some with some of the population health management systems. They work very well, okay? And some just don't have those capabilities. So they take, we take feeds of attributed member information that they want to be able to have at the drop of a hat during an encounter.
Excellent. John, I appreciate you sharing these insights and perspectives. I think burnout's a topic that's really important, and it's interesting to see what Holon Solutions is doing to help out. So thanks so much for sharing your ideas and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, John.
Thank you, John, very much for all you're doing.